This lecture will look at nursing situations for clients with hypertension. Please review the pathophysiology in your textbook before beginning this lecture. Hypertension has had some recent changes as far as criteria for when patients are considered to be hypertensive. There was a study that was done and new criteria were set, so it may be a little bit different from what you've heard in the past. But typically a consistent elevation of a blood pressure systolic above 140 and a diastolic above 90, or a report of the patient taking hypertensive meds. Blood pressure classifications have been broken down into normal, prehypertensive, and stage 1 and stage 2. Normal blood pressure is now considered anything less than 120/80, and for this obviously no treatment is needed. For those patients that are prehypertensive, that would be a systolic between 120 and 139 and a diastolic somewhere between 80 and 89. Typically those patients are observed. No treatment may be necessary other than some maybe lifestyle factors such as weight, nutrition, and exercise. Stage 1 hypertensive patients have a systolic between 140 and 159 and a diastolic between 90 and 99. And typically these clients are treated with diuretics and ACE inhibitors, whatever particular medications their physician feels will be best for their particular type of hypertension. Stage 2 hypertension is a systolic greater than 160 and a diastolic over 100. And these particular patients are usually treated with different drug combinations to bring the blood pressure down. Please see your book for classifications of blood pressures and some further information. Types of hypertension are essentially broken down into primary and secondary hypertension. You'll hear hypertension referred to as the silent killer, since the condition may proceed undetected and uncontrolled, and this can lead to organ damage, strokes, heart damage, kidney damage, things like that, without the patient having a whole lot of symptoms. Essential hypertension is 90% of what clients have. There's no direct cause of the hypertension. It could be just due to genetics, hormone changes, alterations in sympathetic tone, those types of things. Whereas secondary hypertension, which is about 10% of all clients have this type, there's some sort of an underlying cause that has caused the hypertension. So think of those patients that perhaps have kidney disease and the angiotensin system is altered. Maybe those patients that have a narrowed aorta, endocrine problems, neurological problems, the patients on certain medications, such as methamphetamines or cocaine that can cause increased blood pressure and those types of things. So also we think of secondary hypertension would be those patients that have pregnancy-induced hypertension. Risk factors for hypertension include those modifiable and non-modifiable risk factors again, which we touched on also in the first cardiac lecture. So modifiable would be lifestyle factors such as smoking, physical inactivity, stress, diet high in salt, fat, caffeine, obesity with a BMI greater than 30, alcohol, increased cholesterol, electrolyte, things like that. Non-modifiable risk factors could include patient's age, family history of hypertension or premature cardiovascular disease, the patient's race. Typically hypertension is higher in the African American population, and also the patient that may have diabetes. So remember, hypertension is more common in men than women until after menopause, and then the increase in incidence increases after that. It's known as the silent killer because patients don't feel sick in the early stages of hypertension elevations. Typically it's asymptomatic, and as a matter of fact, many patients feel worse once they go on blood pressure medications because they don't like the side effects of the blood pressure meds, and so sometimes there's issues of non-compliance with taking meds because the patients actually didn't feel bad when they had high blood pressure. However, it can damage the blood vessels of the major organs, including the brain, the heart, and the kidneys. It can cause all sorts of elevations that can affect blood flow and those types of things. It can lead to development of atherosclerosis, blood vessel damage, and all those types of things. So even though the patients may be asymptomatic, they do need to be treated for those elevations in blood pressure. With those patients that have significant elevations in advanced hypertension, the patients may actually develop headaches and blurred vision, spontaneous nosebleeds, depression, nocturia, confusion, and nausea, vomiting. And remember, it can lead to cerebrovascular accidents, which is a CVA or a stroke. It's typically diagnosed by 2 or more elevated blood pressure readings. Those are usually done supine and also sitting, and obtained on 2 separate occasions. So if the physician has a patient that comes in for, just say, a routine problem, they note an elevated blood pressure. On examination, the patient will be brought back again to see if that was a fluky thing or if that patient has a true elevation in blood pressure. Additional tests may be ordered for these patients, such as looking for kidney problems, an EKG, echocardiogram. They may do carotid and femoral ultrasounds, look at C-reactive proteins, which can look for inflammation, and also look at albumin and creatinine levels and those types of things. All of these will help to develop if there's been organ damage in any other areas of the body. Good calls for nursing for these patients could include the following: decreased cardiac output and tissue perfusion due to elastic tissue is replaced by fibrous collagen, which is less distensible or has less elasticity, which can lead to decreased perfusion to the brain, kidneys, and heart. The patient may have ineffective health maintenance, because remember, they need to have lifestyle modifications and medication to treat it. And like I said, they don't a lot of times like the side effects of the blood pressure medications. And risk for ineffective therapeutic regimen management. So difficulty sometimes adhering to their different types of treatment modalities. Nursing responses include education for the client. That was just a little wake up there for you in case the lecture was getting a little dry. Diet and exercise modifications. Make sure the patient knows to look for signs and symptoms of complications that we touched on earlier, such as vision changes, headaches, dizziness, weakness, things like that. Making sure the patient maybe needs to be involved in stress reduction types of behavior modification classes or counseling, that type of a thing. And making sure that that patient is following up with care for frequent blood pressure checks, and getting that patient a blood pressure monitoring device at home. If they can't take one manually, there are many blood pressure machines that are good for home care, where the patient can just push a button and get their blood pressure reading that way. Medications used for the patients with hypertension are varied. Typically, a patient will if they're in the early stages, just started with maybe diuretic only, and then if that's not bringing down the blood pressure, then other medications will be added on to that regimen as needed. Some patients may be on multiple medications to try and bring down their blood pressures. So please make sure that you read through your readings in your textbook to look at how these different types of medications work to bring down the blood pressure, what the side effects are for these different types of medications, and what some names of these different types of medications are. Here's an NCLEX question for you. An exercise program is prescribed for a client with hypertension. Which intervention would be most likely to assist the client in maintaining an exercise program? So read through those and see which one you come up with. And the next one is: the nurse understands that a priority nursing diagnosis for the client with hypertension would be which of these following? So remember, on the actual Nursing 224 tests, they will be NCLEX types questions on the test. The questions will already assume that you know what the disease is, you know what medications are used for a particular disease, and then it's going to ask you, so a nurse taking care of a client with a particular disease on certain medications, what are going to be the best assessment pieces that are needed, or the best interventions that would be needed for that patient? Or how would you do teaching, that type of a thing. So Read through discussion board also, and it gives lots of hints for studying for exams in Nursing 224.